Good morning and welcome to Global Healthcast, brought to you by Global Health Press. We are happy to present to you today our diverse topics on COVID-19, the TBE-ISW meeting in Vienna, new US data on COVID vaccine and booster effectiveness, more on TBE, diagnosis of COVID and a greater risk of seizures, pathogenesis of TBE, parents' vaccination status and reduced risk of hospital admission for children, extended TBE vaccine booster doses to every 10 years, and finally, flu vaccines for people with heart failure. I am Joe Schmitt, and with me today is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmitt, and good morning, good afternoon, good evening, everyone, depending on where you're watching our Global Healthcast.
So, Melvin, I'm very eager to learn after 2 weeks where we are with the COVID pandemic.
Yes, so for those of you who have been watching our Global Healthcast, you already know that we always start with this quick update, and we get this from the WHO COVID situation report. And again, this is not real time, this is a week late, but just like last week, the number of new weekly cases decreased by 5% and as compared to the previous week, and also the number of weekly deaths decreased by around 13% as compared to the previous week. So overall, it looks good, right? But at the country level, the highest number of new weekly cases were reported from Japan, Korea, the United States, France, and China, and the highest number of new weekly deaths were reported from the US, Japan, China, France, and Russia. So what I'm trying to say is, if you look at the global overall picture, the cases and deaths are going down. But if you look at specific countries, cases are actually going up in some countries.
Look, Melvin, in the past year, or even even spring this year, everybody who had respiratory symptom among my friends and family, apologies, everybody had a positive COVID test. I mean, if you had a respiratory symptom, it was COVID. And now actually my daughter called in just last night, and she has no COVID. She tested herself twice now, and she is negative. And it looks as if she's having, I guess it is influenza, I'm not sure, but is it still interesting to go on with COVID? Is this now a yearly epidemic and that's it?
Well, I think it might be for temperate regions where you have this kind of surge during the cold months, right? But if you look at this global epi curve, you will see that since January this year, cases and deaths have been really going down in general, right? So maybe with the next few years, we can then probably have a better idea of whether this is going to be like a winter virus like flu, but I think it will be.
Yeah, we have to think about how we cover respiratory pathogens, because this is the burden of disease to humanity, right? On average, a human gets sick 10 times a year, and 6 of these 10 times it's a respiratory illness. So we keep you posted on respiratory events in the medical community. Melvin, I have attended the International Working Group meeting ISW on TBE in Vienna last week. And there are a couple of nice messages out there on TBE. And I just want to cover the basics to begin with. TBE is a central nervous system infection caused by the TBE virus, or TBEV. It has a complex complex epidemiology, which I don't cover in detail, but basically there are ticks. The ticks get the virus from the viral reservoir, which are rats, and they infect humans. And sometimes they infect animals like cows, and then humans drink the milk of the cows, and then you get TBE from drinking the milk. So there is a cycle of the tick, there is a cycle of the virus in the mice, and then there is the end host is the human, and you come down with TBE. That is the short story. Again, it's ticks or unpasteurized milk, how you contract it. The disease occurs from the United Kingdom to Japan and from the North Pole down to Africa, actually, we know now. Most cases occur May to November. The incidence is roughly 1 per 100,000 to more than 30 per 100,000 in highly endemic countries, and it changes all the time. There are 3 subtypes which I don't cover today. Most patients have no symptoms. Then there are a plethora of non-CNS diseases, from psychiatric disorders to diarrhea, and the most severe is certainly central nervous system infection, encephalitis, which is infection of the brain. The sequelae are frequent if you had the severe disease, and the case fatality rate is between 0.5 and 20%. So this is something already, right? You don't want to die from that viral infection. There is no specific therapy, and WHO, European Centers for Disease Control, they prevent vaccination as the best way for prevention. I guess with that, I hand over to you to the next topic, to COVID-19 and vaccines.
Yes, this is data from the US CDC. And in general, just the message of this is that all vaccinated groups had overall lower risk of dying from COVID and testing positive for COVID-19 compared with people who were unvaccinated. But the other data that is valuable from this resource is that it's showing us that people who were vaccinated with an updated bivalent booster had lower rates of dying from COVID and lower rates of testing positive compared with people who were vaccinated but had not received an updated booster dose. So the message is get your booster dose.
I think, Melvin, the error by many governments was to not communicate that the vaccine does not prevent the infection, but it controls the disease. You don't die. And I'm very impressed by comparing the black line, the blue line, and the green line, which is the latest booster, right? So yeah, the more updated your booster, the less likelihood you have for dying from COVID. Very impressive data. Mm-hmm. Very good. And I continue with TBE epidemiology. And this is the latest map on TBE, actually going down to county size, that is presented at the TBE book website. And you see here, we do know that there is TBE in the United Kingdom at the polar circle, and it's going up to Northern Africa and to Japan. Why do I show you this? I show you this map because this map is lying, because the white spots are white spots due to a lack of surveillance and testing patients. In Japan, there is not even a commercial test for looking at TBE in patients. So don't be surprised if there are many white spots in Japan. That may not be true because people don't test. The same is true in South Korea. The same is true in some parts of Germany that are labeled as non-endemic. But this is why doctors don't test. If you live in a non-endemic area, why would you test for TBE? But we know today that the epidemiology of TBE changes on an annual basis. There may be years in one area with TBE, and 5 years later, there is no TBE. So this is an ever-changing picture, and the only way to find out the disease burden due to TBE is systematic testing. And this happens probably only in Austria, not in France, not in Spain, not in northern Italy, not in any of the countries here in the Mediterranean area. So that I think we have many, many white spots there due to a lack of surveillance and testing. And any questions on that one before we go to seizures, Melvin?
No, I think it's really important to have surveillance, not just for TBE, but for other diseases in general, right? We've seen this with COVID, that if you stop testing or if you reduce your testing, of course, you will see less cases.
Yes.
Yeah.
Yeah. If you don't take the temperature, you won't find a fever, is the old saying from the nurses, right?
Yep.
Yeah. Very good. Here, neurology, epilepsy and seizures after COVID.
Okay. So this study looked at people with COVID-19 infections and people with influenza, and They measured the incidence and hazard ratios of seizures and of epilepsy to understand the potential association between COVID-19 and seizures in the 6 months after infection. The incidence of new seizures or epilepsy diagnosis in the first 6 months following COVID was low overall, but higher than in matched patients with influenza. So it's just something for us to take note that really COVID-19 is causing much more post-infection events, neurology events than influenza.
I guess this is an important reminder that while the coronaviruses are entering the human body via the respiratory tract, they cause systematic illnesses. So this is all over the body. They're anywhere, in the brain, in the liver, in the muscle, in the heart, everywhere. And this is just another reminder that there is more to corona than respiratory infections.
Yep.
Very interesting. Would we know anything about the pathogenesis of epilepsy? Is this small infarcts or vasculitis or anything known about this?
Well, I think the theory is either inflammation, vasculitis, clots, and all these different things that can actually be systemic, not just for the brain, but for other parts of the organs as well. Yeah.
Very interesting. I just have a small summary on the TBE virus pathogenesis. So this is the hiker in an endemic area, let's say in Japan or China or wherever. The tick bites your skin and transmits the virus into the skin. The virus replicates locally. And then the virus goes to the blood, and then you have a first illness, which is influenza-like. You don't feel well, you have myalgias, you have whatever type of systemic complaints. The virus at that time also spreads to different organs and can cause anything from diarrhea to psychiatric disorders, but it also may go to the brain, and after a lag period of I guess 1 to 2 weeks, you may have brain disease, brain inflammation, and that is called encephalitis. So usually TBE is a two-phase illness with a first illness when the virus goes into the blood, and a second illness where the virus affects the brain. This is the short pathogenesis, and I found a very new way. Actually, I think of applying for a patent for that, how to prevent the tick bite. Melvin, what do you think about my patent idea?
Yeah, I think this is very innovative, and we can really do this. It's practical.
Yeah. I think this is the most simple way to prevent tick-borne encephalitis. Melvin, you have another story on COVID vaccination and parents and children.
Yes, this is a cohort study from the COVID-19 Pediatric Observatory Study, or the PANDOR. It's a French national prospective surveillance study of hospitalized children with SARS-CoV-2 infection. So what they found out was that during both the Delta and Omicron waves in France, so this was between May 2021 and February 2022, parents' vaccination status was associated with a reduced risk of hospital admission for SARS-CoV-2 in children younger than 5 years old. And I think it makes sense, right? If your parents are vaccinated and protected from COVID-19, their chances of passing COVID to their kids are reduced. So I guess for me, it's very logical.
Yeah. Look, for influenza, the fire of the epidemic are the children. They go to kindergarten, they bring influenza back home, and they infect their parents, like with the pneumococcus. For the SARS corona, this is different because there is no adult immunity. And as there is no adult immunity, the reservoir is the adults and they give it to the children. So this is the reverse situation. Would you agree, or is this just wild thinking?
Yes, I think that makes sense because this is still considered new, right? I mean, even though we are now in the third year of this pandemic, right? It's still relatively new compared to influenza that we've been exposed to for decades already.
Yeah, and protection does not last long. And this is different, with influenza, you always have a little bit of infection from past infections, right? But with corona, we only have this now 3 years, and many adults no longer are protected neither by the disease nor by the vaccine. So the situation is different from influenza. But very interesting study. Thanks for sharing with us. I have a little bit more on TBE, and that's the reason why I have this today. There is protection from TBE by vaccination. And the schedule is you give 2 doses, 1 to 3 months apart, and then you give a booster dose after 5 to 12 months, and then you give another booster after 3 years, and then you give another booster dose every 5 years, and if you're over 60, every 3 years. And these numbers change a little bit by country. It's a little bit different due to the licensing process that happened ever since 1976. So each country has a little bit their own schedule. This is the most complicated vaccine schedule on any vaccine, unless, Melvin, would you know a more complicated one?
I think this would be the most complicated vaccination schedule.
Yeah. Actually, for travelers, it's 2 doses, 2 weeks apart. And then again, you give next season or before you travel again, you get a booster dose. Again, it's the most complicated schedule. And the reason for this complicated schedule is that the vaccine was licensed more than 40 years ago in 1976. And it was all based on immunology. It was only based on titers. And that is the problem. If you follow titers, this is what you should do. And maybe this is not, you should not even be every 3 years, but every 2 years. And this should be maybe annual boosters, right? If you want to be on the very safe side. So this is the most complicated schedule. Now, I guess coming to this ISW meeting in Vienna last week, again, it was clearly stated that the licensing schedule for all TBE vaccines, there are 6 of them out there, is solely based on immunity. But over the last 40 years, there are effectiveness data from several countries. Now, 3-4 years ago, the Pfizer medical team said that these many TBE doses are unethical. We looked at the effectiveness data from Latvia, Germany, Austria, and Switzerland, and we said, look, the vaccine has a high effectiveness, more than 90%, usually above 95%, even if doses are missed for more than 10 years. And we said it is unethical to give that many doses. And we can discuss this in a minute, Melvin, but I think this is the only time that the commercial company applied for giving less doses. I've never heard that a company did this, but the medical team and the commercial team in Pfizer, they agreed that it is unethical to give that many doses of TBE vaccine. And along that time, Switzerland and Finland, they already recommended a booster every 10 years. And in Vienna last week, the Swiss data were presented and they're already published by now. If you extend the booster dose to giving the booster every 10 years only, there is no increase in TBE case numbers. And the final story is the vast majority of TBE cases in Switzerland, in Finland, everywhere are due to a failure to vaccinate and not vaccine failures, irrespective of missing doses. So I think there is compelling evidence now that giving a booster dose every 10 years is more than enough, and everything that is more is hard to justify. What is your view, Melvin, here?
No, I think for a vaccine that has a very complicated schedule like this one, it really makes sense to revise the schedule to make it easier. And the second thing that you pointed out is that for a commercial company to reduce the number of doses, it's against the messaging of anti-vaccine groups that it's all about the money and the doses for the company, because in actuality, companies are looking at science and the data itself as well.
Yeah. Would you know any other example where doses were reduced?
Just for the HPV vaccine, because initially when they were first launched, 3 doses were required. And then eventually it became 2 doses. And then eventually for younger kids, they say that only 1 dose is enough. But this was not initiated by the company, but initiated by researchers who did the studies, effectiveness studies.
Yeah, actually, EMA guidelines are you start, if you don't have an efficacy study, you start with immunology, and if you have effectiveness data, you follow effectiveness. So EMA did not apply their own rules. They did not adhere to their rules, but they have, I'm not sure what they base their schedule on right now, if they will continue with immunology or if they want to continue with effectiveness data. Maybe they want to reverse their guidelines, but they have not done that to the best of my knowledge. In any event, Melvin, you have another very interesting topic on flu.
Yes, so an international study led by researchers from McMaster University in Canada found that influenza vaccines greatly reduce both pneumonia and cardiovascular complications in people with heart failure. We've known this for many years now because of studies looking at health records and studies looking at retrospective cohorts. But this is the first clinical trial of the flu vaccine's effectiveness, specifically in patients with heart failure. And I think the message here is that if you are a patient with heart failure, or if you are someone with some cardiovascular disease, get your flu vaccine really, because it will reduce your risk of pneumonia and cardiovascular complications during the flu season.
I think, Melvin, this is an important topic. Do you die if you are 75? You have, you have a heart problem due to coronary artery syndrome. So if you now have COVID and you die from myocardial infarction, do you die from corona or from heart disease?
Well, I think this is a very good topic to discuss, because you can argue both ways, but you can also say that your disease was exacerbated by the virus, right? So
Yeah.
I don't think we can untangle them, because it's really the virus that would cause all this inflammation or clots that would increase your risk of cardiovascular complications.
Yeah. So you cannot distinguish in the end if you die from or with corona, and that is the important point. Get your shot and then you don't die, right? Mm-hmm. That's the short story. Very good. So today we covered COVID-19 update. Numbers are going down in most countries, but not everywhere. There are exceptions. I told you about the TBE-ISW meeting in Vienna last week. Melvin showed you data from the US CDC that booster doses, and the most recent ones, the more you have, the better to reduce the likelihood of dying from COVID. I told you the epidemiology of TBE, which goes from the United Kingdom to Japan and from the polar circle down to Northern Africa. Then Melvin told you that COVID is associated with a greater risk of seizures and epilepsy in a 6-month period after infection. I explained the pathogenesis of TBE. Melvin explained how the vaccinations that unvaccinated parents give COVID to their children and increase their risk of hospitalization. And finally, we covered the extended TBE vaccine booster doses to every 10 years. This would be the ethical way forward, but it was declined by the licensing agencies. And finally, very interestingly, Melvin covered flu vaccines for people with heart failure. You die with COVID if you have heart failure or if you have a heart problem, but don't miss your booster because you may not die. That's the most important thing. Even if you die from myocardial infarction, the final tip that brought you to die was the coronavirus. Melvin, this was great. Thank you so much again for your literature review today, which was very interesting. That was really fun.
Thank you, Professor Schmitt.
Yeah, and this is your last slide, right? Maybe you
Yes.
summarize your talks from today.
I don't think we need to explain this. Basically, SARS-CoV-2 became a pandemic, and really now it's an IQ test. And I guess if you don't understand what this means, then it is what it is.
Yeah. Thank you, Melvin. This was our Global Healthcast 21. I am Joe Schmidt, and with me today was Dr. Melvin Sanicas. Goodbye.
Thank you, everyone. Stay safe.